Hello, my name is Anahita, and we are here to present to you Depth AI, a platform specializing in delivering expert second opinions on prescriptions and diagnoses. In the United States, over 250,000 deaths have occurred due to preventable medical errors, and 44% of these errors are due to mistakes in medication. Adverse drug events are when patients are given the wrong dosage, prescription, or wrong method of administration, as well as drug mix-ups, which impact more than 7 million patients and cost almost $21 billion annually across all care settings.
And so, for example, talking more about the four big problems. Firstly, wrong dosage. For example, giving 10 milligrams versus 2 milligrams for a prescription. Secondly, wrong prescription, such as giving heartburn medicine for a thyroid problem. Thirdly, mixing up drugs due, for example, to a poorly written doctor's note. And finally, just being unaware of how to use drugs, just taking an oral drug via inhaling it. And moving on,
So there do exist solutions. However, we found that they are not automated most of the time and that they are mostly for physicians. So our solution is AI based, which means that it is really quick and gives immediate feedback, and also it gives power to the patients mostly. That's our main focus.
And so, once again, to solve this problem, we created Death.ai. We utilized Reflex to provide a Pythonic framework to create a website, allowing for extended functionality with images, and also allowing easy integration to Gemini, a new Google AI chatbot that allows for not only text but images to be fed into it to create results, in our case, health information for the patient. And for example, you see that we set up a simple website with the ability to authenticate and to view a dashboard. And finally, we have our AI functionality.
All right, so the best way to get to know Depth AI is through actually using it. So here we have two real-world case studies where the patients are kept anonymous for privacy reasons, but we've given them pseudonyms. And essentially, we're going to walk through how these real-life case studies can be translated into actually using our AI. So for example, this is Rex. He's a 69-year-old male. He's had previous health problems, including heart, spine, kidney, and neck problems. He had a voluntary surgery to repair his spine, and he was placed on some sort of opioid painkillers that's called PCA for short. And essentially, the doctors didn't take into account his prior kidney problems. And because of this, he fell into fatal respiratory depression. He was found unresponsive and unfortunately declared dead. So how could Rex use Depth AI to prevent this? So here we see Rex inputting his personal information and his diagnosis and the medication he was put on. And then if we ask about the prescription and get a second opinion, we see that the AI is outlining potential risks associated with this medication, including the fact that it was overlooked about his past kidney diseases and the fact that that can lead to respiratory depression.
All right, now let's meet Stella. Stella is a 2-year-old girl, and because of her age, that makes her more prone to medical errors. She unfortunately was a burn victim and was prescribed medicine. Unfortunately, though, this was an overdose and was almost 5 times more than what was anticipated. Now, what could have our tool been used to help for? Basically, it could have given context about the situation and then figured out if the dosage was too much, too little, and you can see that it correctly identifies that the dosage given was too much. So that could have been insightful information.
Moving forward to implement Depth AI, we will consider the following steps. First, we will increase data sources to improve model accuracy by passing in relevant data regarding diagnosis and past cases of medical errors. Secondly, we will enable a way to sync with medical records with healthcare providers like Kaiser Permanente to streamline input queries. Finally, we will tailor the software to hospitals and pharmacies and address errors at the provider level.
All right, so let's just summarize that whole thing. Medication errors are prevalent, they harm millions of people, and they are sometimes, most of the times, actually preventable. So our solution empowers patients to go and see, is their prescription correct? Is the dosage correct? How do I even use this medication? And that can help to reduce these medication errors. So thank you for your time, and enjoy your day.
Enjoy your day.